Let's talk a little detail into the orthosis. This is the most common orthosis. This is your soft cervical collar. So it just provides a support. So it helps in reducing the paraspinal spasm. So minor sprains we're using of late. This is not being recommended much. Some people use it for cervical spondylosis. It's controversial whether it's going to make a difference or not. If there's a blunt injury, if there's somewhat of mild whiplash injury where you want to just immobilize the neck, cervical collar is the best. And this, depending upon the size of the patient, you decide. Of late, you have ready-made cervical collars, my small, large, and extra large. So the patient can choose which fits his neck and wear it. Then you have the cervical orthosis, that is a Thomas collar. These are hard collars. So these are typically used with either plastic or with a foam inside for the compound. So this is mainly to give support. That means it immobilizes the cervical spine, especially the flexion. So it is in unconscious patient when you don't know whether the cervical injury is there or not during transportation. It's better to put a hard cervical collar so that even if there's an injury, you are not aggravating the injury by moving it. Once you put the cervical collar, the cervical spine gets immobilized. So in fractures of C1, and if there's a spondylolysis in the C2 and C3, if there's a dense fracture or post-operative, that means when you want to immobilize the cervical spine, either because of an injury or post-operatively, use a hard cervical collar. When you don't want to immobilize the cervical spine but just want to give rest to the cervical spine to relieve the spasm, paralysis, sprains, use a soft cervical collar. And in this hard cervical collar, there are many types of are available. So each one has its own advantage and disadvantage. We will not go into the details. Normally, this is the one which is kept in the exam. So if the examiner asks you difference between hard and cervical, soft cervical collar does not immobilize, it only supports. Hard cervical collar immobilizes. And immobilization is required in certain fractures of the cervical spine. In unconscious patient during transportation, when you don't know in unconscious patient whether the cervical spine is injured or not, and post-operatively after surgery on the cervical spine, you use a hard cervical collar. The next group is cervicothoracic orthosis. So this is a rigid frame. It extends from the thoracic region to the cervical rim. The classical is the halo fixator, and you also got 4-post cervical collar. Again, this is a very popular cervical collar. Then you have sterno-occipital mandibular orthostomy, and of course the last is Minerva jacket. I'll show you briefly what these things are about. So 4-post cervical collar is, it's got a padded chin and an occipital plate. Then 2 padded plastic plates on either side will be there on the shoulders. So this rigidly immobilizes the cervical spine.